Thank you for joining and welcome to today's WRASAP Network Quarterly Meeting. The WRASAP program is the Western Regional Agricultural Stress Assistance Program. My name is Esmeralda Mandujano and I am with the California AgrAbility Program at the University of California at Davis. Our program is responsible for hosting this network quarterly meetings for the WRASAP network, and today's presenters are our partners at Oregon State University, at FarmMade, and also at Washington State University. And I will speak a little bit more about our presenters shortly, but I want to start off with giving you a little bit of background on the Western Regional Agricultural Stress Assistance Program. This is a program that is funded by the U.S. Department of Agriculture under their NIFA programs, specifically under the Farm and Ranch Stress Assistance Network grant, which establishes regional networks that connect agricultural producers, farmers, ranchers, farm workers, and others in agricultural related occupations. And we connect them with resources to assist them in times of stress. There are 4 regional programs. The program that in the area that we cover is, like I said, the West. It includes 13 Western states and 4 territories. So that's that image is depicted by this map here that we have. And those 4, you can find more information from those 4 regional programs at our webpage at farmstress.us under the About tab. Specifically for the Western region, like I mentioned, we have this large area to cover, and this is why we have a large number of partners. And these are some of the partners that we work with, some of the main partners, including Washington State University, the University of Nevada at Reno, Montana State University, FarmAid, which you will get to hear a little bit more from FarmAid today, from Utah State University, the National AgrAbility programs. So really a lot of programs around the United States. Specifically for WRASAP, we have efforts include a clearinghouse. So this is like a searchable resource database. And the goal of this is to build a comprehensive searchable database to facilitate easier navigation of resources. So they're categorized by the needs, or they're also categorized by the state or area. And that clearinghouse is updated constantly so that the searches that come up are active programs. We also have a small grants program. This is a program for partners, collaborators, and stakeholders, and they can request funds that address causes and solutions for agricultural stress in the Western region. And these are small grants that are offered 4 times a year, typically in the fall, winter, spring, and summer. And depending on if we have funding available, we currently do have funding available, and funds are typically used to educate either yourself or your organization to reduce related stress issues, and also to prevent agricultural suicides in the specific territory of the applicant. Funding opportunities are available in 3 categories under the translation, outreach, and professional development. Another effort of the WRASAP program is extending existing hotline operation hours and training the line staff to better support agricultural populations. So again, an example of this is FarmAid. And another effort, and for the one that we are here today, is for the network portion. So for the network, we are seeking to create a space to where collaborating and expansion of the network can ensure that we're doing it in a culturally humble way to reach and support farmers and farm workers when they are going through times of stress. And again, this is for a large region which covers Alaska, Arizona, California, Colorado, Hawaii, Idaho, Montana, Nevada, New Mexico, Oregon, Utah, Washington, Wyoming, and the 4 territories. Sorry, my slides are a little slow. Here we are. So a little bit more on this networking meetings. These networking meetings are a space for stakeholders to be able to build connections and collaborations to assist agricultural producers in times of stress, to improve behavioral health awareness, literacy, and outcomes for agricultural producers, their families and communities, and also a space for collaborators to present their efforts and to offer opportunities to bring questions and bring experiences to the table. And also this meeting is open to the public and it is open for external partners. So if you have a partner that you'd like to invite to join these meetings, they're welcome to join. So this is our agenda for today. We're going to start off with a little bit of intro and announcements, which are coming up. Then we're going to dive into our presentations before we come to a closure. So I'm going to start off with asking Tess McKeel from National AgrAbility Program and Goodwill of Finger Lakes to speak to us a little bit more about an upcoming event. Take it away, Tess.
Great. Thank you, Esme. So as it shows on this slide, oh, all right, I'll bring up mine now. We do have the regional event in Billings, Montana, and it is August 9th through the 11th. There will be some, just a couple presentations on the 9th in the afternoon. So we're going to start around 2 o'clock on Monday afternoon and go till about 5. So that should give people a chance to travel in on Monday morning. And then Tuesday the 10th, we will have a full day of presentations, which will focus on farm stress and mental health, working with tribal nations, veterans, adaptive tools and technology, worksite assessment. And then on the third day, if people want to stay through Wednesday, we do have 2 options of some tours of some local agricultural establishments. There will be a seed and agronomy consulting farm. There's a cattle farm, an aquaponics greenhouse, grain elevator, a farm for people with developmental disabilities, the Huntley Project Museum, a beet farm. So they're not all on the same tour, you know, some are on each, so you can pick one or the other. And there's a little bit of, on the registration site, it shows which ones are on which tour. But just to get here, I just want to let you know, if you go to agrability.org, that's the National AgrAbility website, and you scroll down the side to other trainings and events, that will bring you to this page here with the information about the regional training workshop. I will post that link in the chat box when I'm done. But there's also, here's the link to register. So you would just click on this link. It'll take you, it'll open up another tab for you to register for the event. There's a spot on here for you to click to see the agendas and the session descriptions. We do have a block of rooms at the federal per diem rate of $96 a night at the Billings Hotel and Convention Center, and that is where the workshop will take place. Those rooms are available through July 18th, so that's only 10 more days to reserve your room. So even if you're not sure if you're coming and you're not able to register by the 18th, I would suggest that you at least book your room. It's regular cancellation within 24 hours of the date, so of the date that you're coming. So there's plenty of time for you to cancel it if you're not going to be able to go. But I would hate for anyone to miss getting the room at our rate. But once you click on that, you just click to book your room, and the code to get our rate is right here on the website, right in that paragraph there. The GWF08 is our code. And then just to let you know, registration is open through August 1st. So that gives you just about a month to get yourself registered if you are going to come. And the cost is $120 for all 3 days. If you just want to come for the first 2 days and not do the tours, we have a $65 option to just come for the workshops. And then my email and my colleague Joe Beth's email are right there. If you have any questions, after this presentation or in the middle of registering or whenever, please feel free to send us an email and we will answer any questions that we can. So that is all I have as me. Oh, Esme, you're muted if you are trying to talk to us.
Thank you, Tess, for telling me. So as I was saying, Tess just talked about the regional AgrAbility training that's going on, and there's also WRASAP small grants program funding available to attend this conference. So if you would like to attend, you can submit an application to attend. This would be an application under the professional development that is still open, so you can submit an application for that. Thank you, Tess. So next, I wanted to take a moment to briefly introduce, have an introduction of a new team member for the WRASAP network. So Chad, I'll just ask you to unmute. There you go.
Hi, good afternoon, everyone. My name is Chad Resnicek, and I am the new behavioral health specialist who just started with the Colorado AgrAbility program. So out of respect for everyone's time today and a full agenda, I just wanted to say hello. Thank you very much for having me, and I look forward to meeting all of you and getting to know what y'all are doing. It sounds like there's some great work going on. So thank you very much.
Thank you, Chad. We look forward to hearing about the work that you'll be doing in upcoming networking meetings. So now we will go into our presenters. So right now I'm going to introduce all of our presenters. We'll do all of the presentations back to back, and then we'll collect questions for the end. So first off, we're going to have Cassie Bosky. She is a county agricultural extension faculty with Oregon State University. She works with farmers at the south coast of Oregon in livestock production, commercial horticulture, home horticulture, weed control, but the majority of her time is spent helping with cranberry production. And in 2019, she received an achievement award for the National Association of County Agricultural Agents. Then we will have Rachel Van Boven. She has been a hotline operator at FarmMade since March. She's stationed at Skagit County in Washington State, and she has a background in education, chaplaincy, and farming. She does come from a family of farmers in North Dakota and Washington, and she completed a farmer training with Viva Farms located in Washington State. With her will be Lori Mercer. She's also a hotline operator at Skagit County, and she has a master's degree in agriculture from Washington State University. Lastly, we're going to close with Kate Comtois. She's a professor at the Center for Suicide Prevention and Recovery under the Department of Psychiatry and Behavioral Sciences at the Washington State University. Cassie, we'll have you come on.
Okay, let me start sharing my screen. It keeps telling me that my internet so goes.
You are breaking. Cassie, if you want, I can share your slide, see if that improves connection.
Darn it. Yeah, I was looking at the kind of chop up, so I don't know. Let me stop sharing. Yeah, if you do that. So, I mean, just to get going, I don't know how you found out about the Achievement Award, because I did not tell you about that. That was sneaky. Anyway, so yeah, if you don't mind sharing that would be fantastic. We've actually been working this past year on a farm and ranch stress assistance network in partnership with Washington State University. I guess it was a pilot program. And Kate called me up one day and wanted to know if I'd be part of it, because I had gone to a program back in Michigan, at Michigan State. And I said, heck yeah, sign me up. So we've been working on that. I just kind of wanted to share a bit of what's been happening. Can you find it?
Yes.
Okay. Sorry, I'm in my car. I had a last minute doctor's appointment, and McDonald's apparently doesn't have super great Wi-Fi.
Thank you for trying, Cassie.
So anyway, Yeah, sorry about this. It wasn't as planned. Yeah, you can go to the next slide. So I just have this picture, I don't know if you can see it yet, of an owl, because I don't have an agriculture degree, and my degree is in wildlife science, and I've just kind of fallen into this job. I've been here 7 years and I really enjoy it, but it's been a steep learning curve. Is it flipping over to the next slide?
Yes,
Maybe
we're on the
not.
slide with the owl.
Oh, okay. That's a Google survey. Shows where I'm at, the south coast of Oregon, or they're not coming through. Yeah, basically next slide about what says, what do I do? I'm basically the ag faculty down on the south coast. I cover everything. So we have a big process down here. Easter lilies are grown here. We've got a pretty good livestock industry. I do a lot of pesticide education, handle small farms, and then community horticulture like master gardeners and stuff like that. It's kind of a big job, but we're managing through. Okay, so next slide. So this is, I already taught this, that we partnered with Washington State on our Stress Assistance Network, and that's going through this year. Resources, and developed a website and have provided QPR trainings. Those are like the big picture items. There's been a lot of networking and development of the website together. I've got a great person. Are you on the website page? Is that showing?
Yes.
Okay. Anyway, it's just a really nice website. It's been put together well. And if you go to the next slide, it just does a close-up of the tab. Just a lot of great information. But we had to cancel one this spring, and they were pretty successful. We found that we would have quite a number. They're all online. They're capped at, I think, 25 people or 20 people. And so, at one point we had that many signed up, but only 8 actually came to the class. So getting people to attend is a bit challenging, which you guys have probably found as well. So we're hoping to adjust that in the future. We also are working towards having a series of Spanish trainings, and we actually had one scheduled for the end of last month, but ran into some difficulties and had to postpone that. But that had, I think, after the first week, we had 14 people signed up. There's a lot of interest in that. So we're looking forward to getting that back on track in the next month or so. And then as you guys probably are aware, our state departments of agriculture are able to apply for money from the USDA, I guess, to do more of this work. And so we've applied through our Department of Ag and are pretty certain that funding is going to come through for the next year. And so our big goal now is to just have more educational opportunities, more QPR trainings, just to get information out to people. And then, given the fact that a lot of people just don't want to sign up for a suicide prevention and farm and stress program, I think that maybe is intimidating to people. One of our big goals in the next year is to just connect with more extension agents, and just provide informational presentations, not full trainings, but just to give people an overview of the problem and potential, ways to handle it without being a full training. And so that's part of our goal. And we also want to continue building networks and partners to keep this going. And that's pretty much it. If you do want to get a hold of me, there's my email address and my phone number. I keep forgetting to tell you to switch slides, Esme, so I hope that I'm sure you had it figured out. Yeah, there it is.
I'm following the content. Just briefly, Cassie, for those that may not be familiar with QPR trainings, can you mention what those are?
Yeah, it's question, persuade, and refer. And they're basically, it's an 1.5 to 2 hour training where, gosh, I haven't talked about this for a few weeks. You're basically explaining to the people that the problems with stress and how that can lead to suicide. And then you're basically helping people recognize signs and symptoms, and then figure out how to talk to somebody and how to approach somebody that they have a relationship with, to ask, if kind of find out what's going on, and then helping them get help. That's basically what it is. You're kind of a middleman, because a lot of people maybe won't get help themselves. And so, yeah, I think that's probably a very poor definition of it, but that's.
Oh, well, that's a good explanation of it. That's question, persuade, refer. They're short trainings, about 90 minutes. I believe that's how they are. And it really is a tool to help save somebody that may be having a crisis.
Mm-hmm. Right. Yeah.
Cassie, I really want to thank you for taking all of this challenging driving to a parking lot to get connection. That really does show that, you're invested in this work. And I very much thank you for that. That when you told me I have this last minute appointment, you did not say, let's cancel. You looked for a way to do it. And I think that really shows the spirit of the people that we work with. Even if we have challenges, farmers have challenges coming at them, they will deliver, just like Cassie did right now. So thank you for doing that, Cassie.
Yeah, thanks for having me.
Of course. Okay, so next up, we're going to go with Rachel to learn a little bit more about FarmMade.
Okay. Thanks, Esme. And Lori's also going to be on this presentation. We're both hotline operators for the FarmMade Hotline. And one thing that has happened in April with the hotline is that we were able to expand the hotline hours. It previously was from 9 a.m. to 5 p.m. East Coast time. And because of the FRSAN grant, the WRASAP grant, we were able to expand it. So Lori and I came on, and we are working the later shift. And now the hotline is open until 7 p.m. Pacific time and 10 p.m. East Coast time. So it's more friendly to Western region farmers. So our hotline staff, we have 5 people currently on staff. We are hiring a hotline manager. So if you know anyone who wants to go live in Boston and would be qualified, send them our way. So as you can see, we are all over the country. Molly and Tony just came on in January, and their positions are supported by the Northeast FRSAN grant. And we have a wide variety of experiences. Molly is in law. She's studying farm law. Tony has a full career experience as an extension agent. And Lori and I both, you heard about us in our introduction. And Alex has been working with farmers for about 5 years. So a little bit about the history. The hotline, after the first FarmMade concert, the hotline was established and it would just go to the FarmMade office, and whoever answered the phone would get the call. And eventually that became kind of overwhelming, and so they hired one hotline staffer. And then just this year, we expanded to be a whole team of hotline staffers. So we also have a farmer resource network that we've been running. And in the beginning days, that was just a 3-ring binder that was filled with printouts about information about different resources around the country for farmers to access. So this is a little bit of a busy slide, but I'll explain it. So basically what we do on the hotline is it starts with the farmer. The farmer needs help or they want to start farming. We get a lot of calls from people who want to start farming, or calls from people who are beginning farmers or are very well established or multi-generational farmers all across the spectrum. And they want help. And farmers can be, really well connected, so they can reach out to all these people as well. But sometimes they are looking for additional information of resources that are available to them, so they'll call us. And we're the first responder on here, and we can connect people to organizations, ideally local organizations that can support them in their needs. So we can send them to healthcare providers. We're trained in QPR and mental health first aid. And we can send them to groups that will advocate on their behalf. We have legal services for farmers that we can send them to. And often extension, usually we send almost every farmer to their local extension office as well, if they're not already connected. And then lots of nonprofits that are all over the country. So, and many of these nonprofits have farmer advocates that can really sit down in person with the farmers. So that's a unique thing about the FarmMade Hotline, is that it's a national hotline. And we're kind of relying on the local organizations to know more about what resources are available. So we're collecting all the information about the local organizations and sending the farmers their way. And Lori.
All right, so we take a little time to just give you a snapshot, so to speak, of kind of the volumes of inquiries and the kind of the breadth of the categories of folks that are the topics that people are calling about. So you can see on this slide that it starts in 2002, which is when, regular FarmMade staff just used to pick up the phone once in a while and get this call from a farmer that prompted the hotline down the road. And you can kind of see the gradual growth, except for 05, where we don't have any data. In kind of the cyclical nature of the calls as well that we've gotten over the years. And especially, you can see like in 2020, we really spiked as COVID came on and farmers were trying to pivot and figure out how their markets could shift and on all those types of developments. So that's a kind of a sense of how we've moved in terms of inquiries. Next slide, Rachel. And this kind of shows you all the different categories of inquiries that we get. And you'll see in a little while that we have a great deal of overlap with WRASAP's categories as well. But what you can see here essentially is that the biggest inquiries or reasons people are calling are for crisis assistance, which is 31%. And I do want to point out that when we say crisis assistance, that doesn't necessarily mean it's a behavioral crisis. It could be a disaster relief. It could be a funding need that's immediate. So we call a lot of things crisis. It just means that they need prompt assistance and solidarity. But but 31% of the calls we would categorize as that. About 21% of calls, you'll see our funding opportunities. We get a great deal of inquiries about a lot of questions about grant opportunities. So it's a good opportunity for us to kind of share the landscape and oftentimes have them try to shift their thinking more towards loans than grants, depending on what they're asking about. And then the third largest is 11% of our calls is financial counseling, where they just really want to find someone close by. And again, we're always referring to extension as an option for everybody close by to figure out how to come up with a business plan or their financial plan or anything they have to do to prepare for loans and those types of topics. Next slide, Rachel. And finally, this is kind of our geographic layout of calls for 2019. But you can kind of see, I think that we've already stated before, someone had in a WRASAP meeting that in terms of behavioral calls, the highest percentage of calls in the country are from the Western states. So this is really program that we've got going. It's obviously trying to meet. In 2019, you can see that Wisconsin was a real hot spot, and that could be because of the dairy crisis with family farms that's been going on. It could be because that's where we had our FarmMade concert that year in Wisconsin. And we always get a kind of a jump in awareness and exposure after we're in a state for a concert. So that could be a good reason as well that happened. But that kind of gives you a sense of how broad the scale is on topics that people are calling, and how really just across the country we're getting inquiries from everybody, and how important it is and how nice it is to be able to be available for longer hours on the West Coast now with this WRASAP program.
And just to add, we are, as the new West Coast representatives of FarmMade, we're advocating for FarmMade to do a West Coast concert. So someday in the future, hopefully they'll come back to the West Coast. So if farmers need to get a hold of us, there are multiple ways. They can call the hotline, 1-800-FarmMade. They can also just send an email to farmhelp@farmmade.org. And everyone on the hotline accesses those emails and replies to them. We also have an online request for assistance where farmers can be more specific about who they are, what they farm, how much land they're farming, and what their questions are. Usually if we get a request for assistance and it is a crisis, we will call the farmer as soon as we get it and hopefully get a hold of them. And then if we don't, we'll send an email back with what information we can find for them to start with. So that online request for assistance is on the FarmMade website, and there's also on the Farm Stress website, there's a link to it, to the FarmMade one. So there's two places where people can access that. And then if they don't want to interact with our staff, there's also the Farmer Resource Network where they can independently enter in who they are, where they're located, and what kind of resources they're looking for. And it'll come up with a list of organizations for them to contact. So the Farmer Resource Network, it has a lot of overlap. This is the other piece where FarmMade and WRASAP is doing work in an overlapping way. So on the left is our Farmer Resource Network, and then on the right is the farmstress.us clearinghouse. And it is mostly the same, mostly overlapping organizations. And it's a process that we're working on because the FarmMade Farmer Resource Network has been a little bit lacking in Western resources. It's been more Midwest, East Coast focused. So we're bringing all the resources over from the clearinghouse, and people can access that on either of those websites. Yeah, and you can see on the left what the different services people can select. So yeah, you can see what they will see if they get to the resource network. And the WRASAP, the farmstress.us clearinghouse has a very similar setup. So our call to action for WRASAP partners. If you have not completed a survey and you want to be on the FarmMade Farmer Resource Network, complete the survey, or you can let us know and we can send you a survey and then we can get you on there so farmers can find you on the resource network. And there's always more for us to understand about local resources that are available to farmers. So if there are any support organizations that, if for some reason you're on the resource network and you notice, oh, something's not on there, please let us know and we can reach out to those organizations. Or if you just think there's a really awesome organization we should know about, we are always trying to strengthen the Farmer Resource Network, and especially in the Western states. So that's our current work. And then spread the word to any farmers that if I know there's a lot of people on this call who are actually people that we would refer farmers to, because a lot of people are doing really local work. But if there's someone that you want more expansive resources for, or you don't have time or energy to do research into it, feel free to send them our way and we can support them in the ways that we can. And I think that's about it.
Thank you, Rachel. Thank you, Lori. That was very informative. So I'm just going to reiterate, if any organization would like to sign up to be in that farmer resource, it's a great thing to be added on to, because that also feeds the WRASAP webpage resource database. So it's a good way to advertise, market your services. Great. So next we're going to go with Kate Comtes. I've already done her introduction. I see she's already joined. So I am going to share the slides and have her take it away.
I am Kate Comtois. I'm a professor at the University of Washington, and most of the work that I do is in suicide prevention, and particularly interventions that have been shown to help prevent suicide. And we've been talking about an intervention called Caring Contacts, and we wanted to share a little bit about the intervention with you all, and then ask you to kind of react via a survey that we've put together. So Caring Contacts is a really interesting intervention. It's a very brief intervention where somebody is sending a letter to a person who has been suicidal. So the original study, these folks had been in a psychiatric hospital. I did a study with Marines and soldiers, and we included anybody who had told their doctor or a counselor that they were suicidal, and we brought them into the research study that we did. And the idea is that you send a letter that is conveying connection and support, and you do this over time. So the key is not that it's one letter, the key is that it's repeated letters over time. And they have found that in the original study, it reduced the rate of suicide compared to people who did not receive the letters, and that people tend to respond to the letters with, with gratitude, with respect back. Like, often when we send messages to folks, they'll check and see how we're doing. So I think there's a real sense of connection, and that's the and we've done this study in different ways. There's the VA is using a number of studies with postal mail, where they're mailing a letter to people every month for 4 months and every other month for the rest of the year. That's how they also did it in a study in Australia. We did it with active duty service members because they were moving around and their personal cell phone was the thing that they had with them. We used a text message protocol. I'm doing a study now with a number of Native American communities across the Great Plains and the Midwest, and we've been offering them a choice. So they can choose to get contacted by us from a greeting card or a text message or an email. So given that we've been talking about the fact that, you know, having a cell phone is also characteristic of people who are farmers and doing agricultural work. And we were wondering whether this intervention might make sense. Can you switch to the next slide? Right, so I think I've already said all of this, that the idea here is that that there's this connection. So this is an example of a couple of text message interactions that we had. These are slightly modified to protect privacy, but you can see a couple different examples of the way we did it in our military study, and kind of what the initial messages, these are preset messages, everybody got the same one, but then we responded individually depending on whether someone was expressing distress or just giving us the news of the day, which often happens. Next slide. So this is some of the feedback we got from the soldiers and Marines in our study about what their experience of carrying contacts was, that they found it helpful, that it feels sometimes that people aren't thinking of them. And that's often what happens for people who are considering suicide, is that they don't feel they have a connection. So that's kind of what the goal is and sort of how they responded to that. In our study, we found that it reduced the rate of any soldier or Marine making a suicide attempt over the following year significantly. So the rate of suicide attempts in the control group was about 15%, and the rate of suicide attempts in the people who got the carrying messages was 9%, and that was a significant difference. So that would be our hope. I can't remember if there's one more. Yeah, so we've put together a survey. You can see the link is there, and thanks Esmeralda for putting it in the in there, and we'd love to kind of get your take and feedback on what you think.
So we'll just have everybody click on the link now, and we'll have a couple minutes to take it. It's a fairly short survey.
I will also put in the chat my some more information about the intervention from my website. And I saw a message in the chat about getting the research studies. And so I'll put a list together and pass that along to you guys. I have a list.
Thank you, Professor Comtois. Thank you for having taking the time to give us this information on this important intervention and having us participate on this survey.
Thank you so much.
Yes, of course. So we are coming up to the time of questions. At the beginning of the presentation, we said that we would hold all the questions to the end of the 3 presentations. Are there any questions? I don't see any in the chat, but if anybody wants to unmute their microphone and ask, you can go ahead and do so. I do have some questions, so I will bring up my questions. The first one that I have is for the Professor Comtois. I was wondering if this intervention has also been applied for populations with symptoms of depression, or is it only specific for those with suicidal tendencies?
all of the research studies have been focused on suicide, but a lot of folks have been applying carrying contacts in a variety of settings and catching people who are depressed but not necessarily saying they're suicidal is a really viable thing to do. I just don't know of any research studies that have done it.
Thank you. And another question I had for our previous presenters from FarmAid is, can you give an example of what is a typical contact that you get from a farmer? Or an extraordinary case?
Were you saying a contact that we get or contact that we give?
That you get, like a call. What does a typical call sound like, if there is a typical call, or is there an extraordinary one that you remember that really impacted you because you were able to make a difference?
I think Rachel and I will both say both extremes of that. I'll give a typical inquiry I'll give a typical inquiry call but I have one in mind for one that really touched me too. The tip is someone who's farming. So if it's a call, they're asking about it. If it's like a web submission of those topics, they're clicking land access, funding resources, financial, just right down the list. So it's kind of triaging and trying to figure out the real basic intro to beginning farming to get them started, and then asking them to follow up after they get through that material for more specific information, if that makes sense. And then one for me that was pretty consequential was someone who had called from California last month, or 2 months ago, I guess now, and with the drought, they're a livestock farmer, and she was calling on behalf of her father, who's in his 70s in farming, that their well had run dry, and just how to navigate that. And what ended up happening, we observed confidentiality, but basically what happened is that her brother got a loan and paid for a new well to be drilled. So you're thinking about the huge expense that family took on to keep farming.
Yeah, and that's an extremely stressful situation. I know. Well, we're down here in California, and it's gonna be 111 degrees out there, and their farmers are being asked to don't farm as much because there just isn't the water to do so. So it's extremely stressful. And I think that's why the work that we're all doing is important, because we need to help them find ways to help themselves and help their farms. So thank you for helping them. Do you have any examples, Rachel?
Yeah, I can share one as well, that a farmer called from a state, and he had really just been struggling financially and felt like he was at the end of his rope, as he said when he got on the call, and just sitting, listening, talking with him, and pointing him towards resources that were in his state that he didn't know about. By the end of the call, he was like, I feel so much more relieved. I feel like I can breathe now, knowing that these resources are out there. And he happened to be in a state that had a very awesome one resource, with a lot of help, direct help that I could send him to. So that was really something we talk about, is sometimes just being able to talk through this stuff for farmers is, sometimes they need more, and sometimes just having the conversation with us is the jumpstart to give them hope, or give them at least a next step to take. Yeah.
And that's an important thing that you mentioned too. It was lucky that you were in a state that had that one specific resource. And I think this is also a space for some of us to see what resources are out there or working that we can also bring to our states. It doesn't necessarily, we don't necessarily have to recreate the wheel. If something's already working, why not implement it in other states, especially if there are programs that are supporting to do that.
Yeah.
That's a really good point. Allison did pop a question in the chat. This one is for Professor Comtois. She asks, what kind of liability legal issues might be encountered if wanting to implement this through a university? So this would be the Caring Contacts program.
I think that there's, it depends if you are like, if you're sending them, and one of the questions we ask in the poll is like, who should the contacts come from? And I think there are more complexities actually if they're coming from somebody with a clinical license who could be interpreted as providing clinical care than for somebody who's a peer or a mentor or somebody who wouldn't. And what we generally, I mean, I think, you know, every university would have to think through, or any setting would need to think through liability issues, and people are, depending on how much your university deals with suicide prevention, there's more or less, like my university has a pretty high tolerance for it, but there's a lot of us who do suicide prevention work. And so the university is kind of rolling with it. But the thing that to remember about Caring Contacts is that often we find people who, and catch them at a moment when they need help and can get them back toward care. So, you know, there is a liability to knowing that somebody is suicidal and reaching out to them, and they could reach back and say, I'm actually doing really badly. And nobody would have been talking to them necessarily in that moment. And what we've often found is that we've been able to pull people into services and into care when they needed it, who were otherwise kind of out there floating on their own. So I think there's some pros and cons to that. I'm very happy to provide any consultation on kind of managing that, or talking with anybody at your university or organization about kind of how to think this through. I'll stick my email in the chat, and feel free to reach out to me if you have someone who would be helpful to talk.
Thank you.
Yeah.
I'm just gonna put in the chat one more time the link to that poll. So if anybody hasn't clicked on it yet, go ahead and click on it and take it. As you know, I like to end these meetings a little bit early so that we can practice what we're trying to do, which is taking care of ourselves. It's important to kind of get away from the Zoom if we're in the Zoom the whole day. So take this 5 minutes to take a break or stretch, get a drink of water, do something for yourself, because we need to be healthy in order to provide the best support that we can. So I'm going to stop the recording now, and I'm going to thank you all for attending. And our next meeting is going to be on October 14th. So save the date. That is the next time that we'll have a quarterly meeting, October 14th. And if you have any questions in the meantime, I think you all have my email, but I will put it in the chat, and we'll see you next time. Thank you all.